Good afternoon, everyone. Welcome to CHI Innovate webinar or panel discussion. It gives me great pleasure to kick off this webinar and to also welcome our guests. Today I'm quite happy because there are 5 of us. Don't worry, our masks are off, but that's completely legal because we are safely distanced. So it's nice to breathe a bit of fresh air, and also we're speaking about a couple of things which are very close to our hearts. So food and beverage, traveling, we all like to travel. Transport, we also have transport with us, and our friend from Grab, it's both food and also something very essential in our life, transport and aviation. So things all very close to our heart. And you know, over the last 6 months, the world has been undergoing a lot of seismic shifts. Myself, being clinical director at the National Center of Infectious Diseases, we had to undergo with the rest of healthcare in Singapore many changes which have shaken us up, but I think we have come through stronger. The road ahead is a bit long, but we think we will get through together. And sometimes in healthcare, we sometimes silo ourselves, but there's so much to learn from other industries and what they have gone through, and there are many parallels in our shared experience in COVID-19. I'm the facilitator for today's panel, and it gives me great pleasure to introduce briefly our esteemed guests. We have Mr. Andrew Tjioe, who is sitting next to me. He's the founder and CEO of a group of restaurants which do not need much introduction, the TungLok Group. The TungLok Group, as you know, was established in 1984, and it is a leading Chinese restaurant in Singapore with multiple, under Andrew's leadership, has grown and expanded across the Asia Pacific and in many countries. Next to Andrew is Ms. Jeannie Lim. Welcome, Jeannie. And she's the Assistant Chief Executive of the Policy and Planning Group from the Singapore Tourism Branch. Jeannie assumed her current position on the 11th of March 2019, and she leads policy and strategic matters across STB and supporting research and data-driven decision-making. She is also a leader in innovation. I think even pre-COVID, there were STB threw out a lot of innovation challenges over the years, and I think this entire COVID-19 outbreak has accentuated that a lot. Next to Jeannie, we have Mr. Yee Wee Tang. He's the Managing Director of Grab Singapore, and I think Grab, there's no need for introduction. We all probably have interacted with Grab some shape or form, most of us. And in this outbreak, I think we would be very interested to hear about his sharing about how Grab has innovated through this crisis. And last but not least, we have Mr. Jason Goh, and he's the Managing Director of the Airport Operations at Changi Airport Group. My wife and I like to go. In fact, once the situation opened up a bit and we were it's kind of let loose to safely, of course, our caveat, everything safely with social distancing. One of the places you went was to Jewel and to kind of see what was happening there and what the situation was, of course, to enjoy a nice meal. So I think Jason, I think, you know, the footfall and all the challenges, not only with Changi Airport Group, with all our visitation in Singapore, that has presented great challenges, and we'll be looking forward to speaking to you and learning about your challenges. So welcome everyone, and thank you for joining us today where we are filming this live panel. We are in the Philips APAC Center, and today we are going to talk about the challenges faced by different industries from their first-hand perspective, from their organizations, the innovations created and the transformation journey throughout COVID-19, and also to offer a glimpse into how a crucial thing called leadership, which we heard about in our first session earlier on, and the workforce will need to change and cope and strive in this new normal. I also would like to, for those who are joining us online, welcome to all of you. I'd like to also apologize if you are having difficulties logging on, please rest assured our technical team is working that out, and we hope that you have a good and fruitful session. I think the healthcare challenges with our guests, I'll just kind of have a laundry list of all the sob stories and all the all the challenges we face. Number one, although we knew about this virus, this coronavirus, it was nothing like the previous coronaviruses we knew about. We faced a lot of, it behaved completely differently. We had a lot of plans, but obviously the plans had to change. We had also had to kind of innovate with our workforce. People who normally were not dealing with infectious diseases had to be deployed and kind of reskilled and trained and to work in a new and familiar environment. So many of these challenges we face. And I would like to maybe ask Andrew first about the challenges and that the F&B industry, and in particular TungLok, faced in our battle against COVID-19. And in fact, I think TungLok was also quite instrumental in delivering some of in our COVID-19 efforts. We would love to hear about some of the challenges you face, Andrew. Yeah.
Okay, thank you, Shawn. F&B is one of the industry that is very badly hit, but we cannot compare, cannot complain much compared to travels and then retail, and which are equally affected. So in my 36 years operating F&B, there's nothing like this. We have gone through so many rounds of crisis. We were established in 1984, and then in 1985-86 there was a crisis, and then followed by the Asian financial crisis in 1997. We successfully went through that, and then other than that we have the 2001 911, and then 2003 SARS, and then 2009 we have the H1N1 and also the subprime crisis. We survived all those. So it's nothing like this one. This is unprecedented. And the previous one lasts only for a few months or even 1 year or so. But we don't have to close restaurants. But this time there is a circuit breakers that we have to close all restaurants, can only do takeaway and delivery. And this is quite painful actually. And I would say compared to the previous one, when during economic downturn, usually the fine dining will be affected, but then the casual dining will still prosper. We call it 东方不亮西方亮, but this time, whether it is east or west, whether it is casual dining or fine dining, all dark. So no amount of Philips light, LED light can brighten it up. So it's quite bad. So I think something that we learned from this crisis is that we have to make sure that we stay lean and nimble. We have never, in our 36 years, we have never laid off any staff, and we always pride ourselves for doing that. Even at the beginning of the COVID-19, when I had a meeting with my staff, I assured them that nobody will lose their job, just stay together with us. And I have to change my tone a few weeks after that. And I said, there is no guarantee that there is no job loss. So what we did is that, first clear all your leaves, and then some people will have to go on unpaid leave, and we have to send close to 200 pass holders home, in order to save the Singaporean job. So we kind of lay off 200 to save 500 kind of thing. But I think I would say I'm not ashamed of doing that, especially when you are facing this kind of crisis. Well, we all know that if we don't act quick enough, there will be no chance for the company to survive at all. So when circuit breaker was implemented, so immediately we switched to only delivery, right? And there's 3 blessings that I would say we have. We started this dealing with a delivery platform quite early. In fact, 3 or 4 years ago. So we are quite used to dealing with Foodpanda, Deliveroo, and then later on, Oddo, and then Grab, Food, and then Chope. So we are quite used to it, and our people are quite well versed. And so when this COVID-19, we were not so panicked when it comes to doing takeaway or delivery. Secondly, we have central kitchens. So we've been doing catering for many years, and we are in the good book of the government. So naturally, when there is a lockdown of these foreign workers dormitories, we were one of the caterers selected to supply bentos or breakfast, lunch, and dinner. So this provided, the much needed cash flow during these few months. And we were doing like 12,000 boxes a day. And while we have to close many restaurants, so we send at least 50% of our staff to the central kitchen to do bento, to do packaging of bento, and that also helped, to save their job. Okay, so the third blessing is that we have factory. It's not really a manufacturing, but also a central kitchen, but producing frozen food, ready to eat or kind of heat and serve. We started that many years ago, but the response was so-so because we have restaurants. When there are many restaurants, why go for the frozen food, right? So we sold about 3,000 packets per month. But during this period, the sales has surged to 18,000. So there is it's kind of a 400% increase. So we see the opportunity there. So we switch our, dine-in has started, but you cannot expect the volume to be the same as the pre-COVID, and it will not come back so soon. So we depend on other source of income. One is that catering, and then the manufacturing. So our future business will be 3, depending on dine-in plus takeaway plus retail. So this will be our new business model. Yeah.
So in fact, Andrew, we were talking just before the webinar, and some of the like serving, for example, meals to the migrants who were hit pretty hard in this outbreak was not something new to you, and you had to kind of innovate and kind of change the kind of food that you were also serving. Could you just tell us briefly a bit about what your company had to do?
Yeah, for takeaway, definitely you have to avoid food that is too much soup, too watery, And also we have to be mindful about this to be environmental friendly. And we've been using this takeaway boxes, which is sustainable, made of cornstarch. We call it cornstarch ware or something like that. So we've been doing that, and we're not about to change, even though the demand surged. So we still, make sure that we only use sustainable packaging for our restaurant. But we're unable to do that for the central kitchen because the volume is simply too big. If you're talking about 12,000 pack per day, Nobody can supply you that kind of volume. And also, I'm quite comforted to know that because after the meal, the workers will collect it, and so it is not like going all over the place. Yeah, but for the restaurant, we still make sure that we want to be environmental friendly.
Right.
Yeah. So I mentioned just now about we have to change certain way of cooking to make it less watery. Yeah.
Okay. So lots of challenges around and catering to the customer, which has kind of changed. So thanks a lot, Andrew. We'll kind of ask Jeannie. I think with the Singapore Tourism Board, you saw almost a 80 up to 90% fall in almost all arrivals in Changi. Some of the plans for Terminal 5 were put on hold. How has the aviation, what were the challenges that you saw in STB?
Yeah, thanks, Shawn. So yes, I think very correctly pointed out, tourism and aviation, I think, have really been the hardest hit during this pandemic. So I would sort of talk about the challenges in the 3 different phases. So from the very first phase, I think in the early days, when basically borders were closed and tourism came to a halt, we kind of realized actually we had assets within tourism that actually could be repurposed. And because of the way the assets are positioned in terms of hotels having single rooms, cruise ships having single cabins, they were actually thought to be very suitable to house various categories of guests. And so quite early on, we actually converted a lot of the hotels towards housing people that were on stay-home notice. Some of them have been repurposed to become government quarantine facilities or swab isolation facilities. And so it was very challenging for them because it's, there's a lot of fear, there's a lot of unknown. So we had to go through many rounds of briefings, of training sessions, of course working with health professionals, with NCID, in terms of how do we then convert it while keeping the staff safe as well, and what were the protocols that had to be put in place. Along with that, we also have 2 cruise ships under Genting that have been repurposed during this time to house recovered migrant workers. And that was also something that we had to quickly operationalize within a very short period of time. But I think the fortunate thing is that we have stakeholders within the tourism sector that are very open-minded and very forthcoming. And within a short period of time, we managed to work with Genting Cruise Lines as well as with our cruise terminal operator, SATS Cruise, to really set up these operations that's currently still ongoing. So I think to date, between the 2 cruise ships we have, they've housed over 6,000 recovered migrant workers, and the operations for that is still ongoing, similar to the hotels. So we've managed to work closely with them to actually overcome fear towards providing service where actually it's still also providing some form of revenue to them, although of course it's very much a national effort. And then in terms of innovation, during this time, I think some of the little glimpses of innovation we've seen and very heartened by is that a lot of the hotels that are actually housing SHN or stay-home notice guests, they've come up with creative ideas to keep the guests entertained and occupied. So although they're very much restricted to their rooms, they're not able to come out of their rooms. We have some of the hotels that have put on certain activities, Rasa, Shangri-La, Sentosa. They actually had organized certain exercise sessions, certain music sessions, where the guests in their balconies or in their windows could look out and they could sort of feel that, partake of an activity that helped to keep their spirits up and occupy them during their 2 weeks of restriction within the room.
Was the uptake good? Yeah,
I think just seeing from the amount of social media uploads and posts, I think all that has been very much welcomed as well. I think everyone understands that everyone is coming together to make the best out of the situation they're in and trying to turn something positive in a situation where you wouldn't necessarily think so. So that's one whole period of challenge which the industry is still undergoing. And then when we start opening up, which is phase 2, where we are now, I think the challenge is then how do we work with hotels, with attractions, with tours, to really look at reopening in a very safe way. So we've had to work with them on a set of advisories and safe management measures that we feel can help to mitigate risks while allowing some domestic consumption of these activities, whether it's staycations or going on tours. So last week, STB, we launched our Singapore Rediscovers campaign. It's a 45 million campaign in partnership with ESG, Enterprise Singapore, as well as with Sentosa Development Corporation. And we really want to try and encourage locals and residents in Singapore to rediscover aspects of Singapore which they may not be as familiar as. And so I think a lot of the companies in the tourism sector, they're working closely with us to come up with creative ideas and promotions and bundles for that effort. So at least then it brings in some revenue stream to them during this time where there's no tourism as well. And then I suppose the third bucket of challenge is then really preparing for the longer term. I think many of us are looking at this as a long winter. We don't think until a vaccine is found that tourism is going to return to pre-COVID levels in the near term. And so the challenge now is then how do we work with companies and businesses to repivot to get some revenue streams coming in, as well as to look at how they can prepare the workforce and sustain the workforce for a post-COVID landscape, because it's not going to be business as usual pre-COVID. So a lot of the different challenges we're working with them is to look at how we can redesign some of these jobs as well to sustain the workforce during this time.
I'd like to ask Wee Tang, I remember during SARS 2003, taxi drivers and cab drivers were really afraid to come to the Tan Tock Seng area. They would run away from us. But things seem to have changed during this outbreak, and Grab has gone through tremendous challenges. Would you like to share perhaps what were your top 1 or 2 challenges that you faced there?
Yeah, I mean, like all businesses, we were all impacted. So during the last few months, if someone can put up the slide, so we had actually 30 initiatives around 3 different teams. One is, as we all start to, a lot of us work from home, a lot of new demand is required. How do we satisfy the consumer needs? So we launched multiple new features, new products, for example, GrabMart, island wide delivery, so that we can provide more options to the consumers. That's one. Like many companies also, we would like to see how we can help the healthcare sector, and we want to do our part, and hence we also launched a couple of services, GrabCare and GrabResponse, in collaboration with the hospitals, MOH, who are very, very supportive. Lastly is about safeguarding our driver partners' income. Obviously, with a lot of people working from home, many of our ride-hail transport partners, drivers, are not earning as much as they want. So how do we make sure that their income continues to be protected, and hence some of these services also help to at least maintain that level of income for them. I think going back to the question, comparing SARS to the current environment, I think a few things have contributed to it. Number one, I think number one is information availability. It's just very different back in early 2000s and now. I think Singaporeans are very discerning people. They know what information is, the right information to absorb, and they know how to protect themselves, how to make sure that they, even when they are in a car, they're well protected. So I think that's one. Secondly is obviously we also want to make sure that our drivers feel comfortable picking up passengers who are potentially positive, and giving them face masks, hand sanitizers. We also provided insurance coverage, for example, if they happen to be quarantined or even worse, positive, they are protected. The insurance that cover their income, cover their rental income, to make the rental payment, so they can make sure that they stay at home without any worry on their income. So some of these things actually contributed to that. But lastly, I think is also, I really think that a lot of people really wanted to help. And this GrabCare service was a great example. So GrabCare service, for those who don't know, is actually a specialized service that only healthcare workers can see on the app and book to and from hospital. And this actually started because we saw on social media or feedback from the Nurse Association that there are some drivers refuse to pick up healthcare workers from hospitals. And really within 72 hours, we got a few things done. One is obviously the technology, which is controlled by us. It's actually the easiest part. We know we can do it, it's easy to do it. And then obviously we need partnerships from the hospitals. And you know, Tan Tock Seng Hospital, NCID are the first one to say yes. We have to whitelist the passengers, and they were super supportive. I think lastly are the drivers themselves. You know, we need to make sure that when we provide a service, you know, the drivers, when they get a job, they would 100% accept that job. And when we send out a survey to our pool of drivers, within 24 hours, we actually got 2,000 drivers saying yes. And this is without any incentives. We were not giving additional incentives to them, but they just said yes, they think it's the right thing to do, they wanted to help. I think that's where I think those are the reasons why. The information was there, some protection for the drivers were there. But at the same time, the drivers themselves really feel that they want to do something and help the healthcare sector.
Yeah, I think your efforts paid off because I just suddenly 30 seconds, 1 minute, the driver very fast they accept our booking.
That's
so
great, that's great.
Yeah, immense challenges. And Jason, I mean, we all wish for the day where we can use Changi Airport again, and you know, it's not just to go there because we enjoy the Changi experience, but then, you know, to hopefully kind of fly out of Singapore, you know, to see the rest of the world. How has it been, and what were your major challenges? Yes.
Well, I guess yes. In fact, if you just look at pure numbers, right, this situation that we're in is really unprecedented. In fact, we're just discussing this morning that if we go by the projected numbers that we have today, Changi will see a traffic number that's lower than even when we opened the first terminal in 1981. So for 40 years, you know, it's gone back to zero. So that's really how drastic the numbers are. There are some passengers still, you know, transiting and going in and out of the airport, but we know that what it takes us to serve a day now was what we used to do in 5 minutes. So pre-COVID, Changi serves about 200,000 packs a day. So that, I think, is really the magnitude we're talking about. So the key challenge is not just about the drastic drop in numbers. Is as long as you open the airport and remain making sure that Singapore is connected to the world, and whoever needs to travel during this period still travel, then you must make sure that the safety, security, as well as the hygiene that is expected of the passengers, you know, are really in the best conditions that you have. So in the last few months, even though we have very small passenger number, I think a lot of effort has gone in to make sure that whoever arrives at Changi Airport or Singapore, or departing from Singapore, feels that the place is safe for them. And therefore, look at some of the innovation that has gone in there. Initially, in February, March, we put in this self-disinfecting antimicrobial coating, because airport has got a lot of high-touch surfaces, check-in kiosks, and so on and so forth. So you can never continuously clean. So the touch surfaces were recognized as one concern that the passengers may have. So therefore, we went around coating all the kiosks, check-in counters, and so on and so forth, to make sure that passengers, when they arrive at Changi, they think that, you know, their hygiene and safety are being taken care of. But after a while, I realized that that ain't good enough. So the team has been looking around to say, how do you create a totally contactless journey for the passenger? So as of the earlier this month, now if you go to a check-in kiosk, we'll put in the infrared sensor that you actually don't even have to touch the surface. Right? You just put your fingers near to the surface and you can actually do your check-in without even touching the surface if you don't want to. Right? So that's one. And working with the immigration colleagues, right? They put in place now with the iris and facial recognition. Last time people were very worried about, you know, having to do the fingerprint as they go through the automated channel. Now with facial and iris, actually you just have to scan your passport and you just walk through. So those are things that has come online in the last 1-2 months. that now passengers actually go through Changi, you can almost go contactless all the way from curbside to the aircraft, right? Except the part if you carry something that the security need to check you, then you have to just do some divestment. Other than that, you want to make passenger feel really safe, right? The other thing that we have looked at also is with the opening up of the transit transfer corridors, passengers who are transiting at Changi now, they need, by MOH requirement, a clean bubble to hold them, right? So they don't mix with the local population. So we built a dedicated transfer holding area, which, in their words, right, is a public accessible first class lounge, which is fully full service, where they can get food, they can rest. The important thing at this juncture, right? I mean, Changi is well known because we make sure that every passenger feels that the experience at Singapore transiting or arriving is the best we can do. And during this period of time, every passenger who need to travel will feel even more apprehensive about traveling. So you want them to, when they get into Changi, to feel this sense of relief and relax. So ample space, making sure that the hygiene factors are taken care of. So those are things that we have actually put in place in the last few months. But that's what we can do to this point of time. And we're always trying to look forward, because if Changi cannot open, then the whole economic sectors will continue to be constrained. And that's why we have also been working closely with MOH, right? Looking at new ways, whether it's testing, right? Today, you may have to do a PCR, you do your swab, and it takes a long time to do that. So recently we read about all this, whether it's through saliva, it's a less intrusive way of doing it. So things like that will help, right? If people are traveling into Singapore, that they know that, as a leading international airport, this airport has got my safety and consideration taken care of. And therefore, that's one way we feel, after the COVID, where people can start to travel, we will be able to continue to enhance and keep the competitiveness and the engagement we have with travelers. So always choose Changi when they have a chance to do that. So those are the things that we have been working quite hard in the last few months. And therefore, the innovation that's ongoing in the healthcare sector, I'll just say thank you very much to the healthcare sector. One thing about passengers, even in this very trying period, and they have to choose a place to go to, other than a place that's relatively considered as green or clean, the other thing is really healthcare. In the unfortunate situations with low probability that one comes down, with COVID, for example, they want to make sure that that place that I'm visiting has got a strong enough healthcare system to take care of me, right? So that, I think, also drives people's decision, or where will I choose to go first, when travel recovers. So I think all this work that our healthcare sectors and colleagues have been working on is extremely, extremely important, and that, I think, will be a key driver to where people go.
I think, Jason, probably a lot of parallels between healthcare. Healthcare is always, I think maybe I'll open it up to everyone, anyone who feels free to kind of share. In healthcare, we have a lot of contact. Very traditionally, the patient come, knock the door, come in, sit down, and we'll chit-chat a bit, have that human contact. And then there's actually, you said interestingly, contactless. There's a lot of healthcare services with a lot of contact, and we are looking at stuff like UV lights and how to disinfect. But now in this post-COVID world, maybe I'll just open up, because I think a lot of you, besides challenges, you have started to allude to the kind of innovations that you had to do during this whole exercise. Like, I think for restaurant business, to create the ambience a bit different. I heard some people are lighting candlelight dinner at home with really top grade food, and kind of travel. I don't know about virtual tour. I've logged on to YouTube to tour some museums, but it's not the same thing. How would your, besides the examples I've listed, maybe free for all, how would your, what are some of the innovations you think that your respective industries need to undertake to kind of face this challenge? For one, healthcare, I can say we have started a lot of telemedicine, and we are mailing out medicines to our patients, so it'd be interesting to hear.
Okay, well, maybe if I can start off
Yes,
first.
Jeannie,
I think
yes.
on the tourism side, we've just launched our Singapore Rediscovers campaign, as I shared. But I think some of the innovations that we've seen some of our tourism companies do, one example I can quote is by Wildlife Reserve Singapore. So, because not as many people previously could go to the zoo or the bird park, and even now they've reopened, but there's some capacity limits that has been imposed as well. So they've launched this initiative called Hello from the Wild Side that allow people to book virtual experiences with animals. So they have their animal ambassadors, and you can kind of select which animal group that you would be interested in. You go online, you can book it, and then the experience is basically an animal ambassador bringing you up close online to the animals and explaining to you a little bit more, and it's quite interactive because then you can ask questions that you're interested in. And previously, there wasn't such an experience available, and people are jostling with crowds. You may not always get
How's
that up close and personal
take-up rate, Jeannie? Is it good? Because some of my patients, some are very traditional. They want to go, and some are like, phew, I don't need to see the doctor, faster, I can just get done. And how's the take-up been in?
I think it's encouraging. I mean, it's still a new initiative, and beyond that, there's quite a few others as well. And so, now we're very much going towards hybrid experiences. Some of the tours as well. Walk and Stroll, a local tour operator, they've kind of launched culinary tours online where they take you through cooking experience. So you kind of cooking demonstrations, and you do it as you go along that tour. Zouk as well, even in the night sports area. They have also come on with online type of party experiences,
Yes, I heard about
cocktail
that,
classes. Yeah, so, and I think they have been receiving positive responses. I think a key challenge at innovation they need to look at is, beyond free experiences, which a lot of people expect if it's online, how do you look at then providing value that people will be willing to pay for? Can you do delivery of certain parts of the experience direct to their homes? Can you provide something that people are willing to pay for that they wouldn't ordinarily get during this time? But we've had some encouraging ideas, and I think we remain optimistic that given all the limitations and restrictions, that there will still be good demand for such hybrid experiences.
Okay. How about Wee Tang? I think Grab, from what I know from first-hand experience, I've used Grab delivery. I didn't know at first. I left my computer cable. I took my wife's computer cable home, and then she was like to the office, and I didn't know that Grab delivery existed, until 2 weeks ago. They're like, how am I going to get, if I drive home on the CTE, it's going to cost me a lot of time, and the meeting is, so I said, there must be an app for this. So I looked it up and I used it. How, you have had to innovate, so could you tell us how?
Yeah, we had to do a lot of things. So, for example, because of the virus, we encourage contactless delivery. So, please tell your driver to leave it somewhere so there's no contact. We encourage the use of cashless rather than cash. But we also need to, come up with a few things. Obviously, the consumer, the way they make purchases have changed. A lot of them move to online. So I think where we see a lot is a lot of the smaller businesses have all gone digital, or at least they're moving to the digital world. During that short period of 2 months, we saw, we actually onboarded more than 2,500 merchants into the so they can sell online. So the other thing is, other than the Grab Express that you mentioned, we also started Grab Mart, which is not, so food is the cooked food, but Mart can be anything else, right? From pharmacy products to groceries to buying fish if you want. So we also pivoted to that because we see that the consumer behavior has changed, but also the merchant side has also, they realize that doing delivery is the next place to another channel for them to sell their products. So some of these are some of the quick innovation. Then one more thing is on the merchant side, on the food side, especially the small businesses, especially the hawker centers. We all love Singapore hawker centers because of the price, affordability. But yet, if you buy a $3-4 food noodle to get it delivered, the pricing doesn't work because you pay a higher fee on delivery than the food. So we did a mix and match model where on just using one menu, we actually list down all the items from many stores into one restaurant, so that consumer can just purchase multiple items from different stores, and when it gets delivered, that consumer only pay one delivery fee. So that way, we bring down the cost of delivery, also to help the people who really need, the merchants who really need them, which are the hawker centers.
And we thank a lot of, I understand a lot of Grab drivers, they are part of, they are called gig workers, right? So, and even in healthcare, because of the surge in some of our operations, we had to employ a lot of locums, part-time staff, gig staff, even our swabbing operations, some of them are part of this gig workforce. Now, do you think that gig economy might be a viable workforce model within healthcare? I know you use and of course, job security is something which is very important to everyone. Or sometimes even if it's so-called a gig economy job, it becomes almost like a permanent or semi-permanent source of income. So, what's your experience been like?
So I think, if anything, this pandemic shows us that gig economy worker can also be essential worker, right? And like our drivers, they're considered essential workers because they do continue to deliver people and food to the Singaporeans. I think the positive, or some of the things that the advantage of the gig economy can be viewed on two perspectives. One is from the worker point of view. A lot of people join us because of the flexibility. Whether you are a housewife who have kids at home, but you want to earn, you can work 2-3 hours a day, you can join our app to work for that 2-3 hours. And that flexibility is actually very attractive to a lot of people who cannot go to work full time. From our point of view, the platform point of view, or the corporation point of view is, the gig economy, the workers actually provide additional workforce supply, especially during peak hours. So, on the road, you can never get enough taxis during peak hours. And if we can bring people who have own cars and to just drive and during peak hours, we can provide the additional supply to manage the additional demand during just that few hours of the week. So I think there's advantage of gig economy. But having said that, I think there's still a lot to be done. Gig economy, I think we need to make sure that it's sustainable, not just for the platform corporation, but also to the workers. And that's something that we have embarked on. We have started to look deeply into how, as a platform, we can help our partners a lot better in terms of providing them insurance, for example, medical insurance, personal accident insurance, as well as there are some of them who join us, just temporary basis, right? Maybe they are looking for a new job. So we want to also make sure that we can help them to transit out of the platform. So we have also programs that, training programs, upskilling program that we work together with some of the government or Ngee Polytechnic to train them so that at some point they can transit out. So I think as a whole, there's definitely place for gig economy workers in many sectors, but I think there's still a lot more work to be done to make sure that the partners are protected.
I'd like to ask Andrew a question. Andrew, I think now that you have moved a lot to this delivery, and also the dining experience has dramatically shifted. For us, the way we are delivering healthcare also is moving more towards a different model also. With all these challenges, and you have to deliver high quality food, so the TungLok brand is upheld. How do you maintain that? And just as that you think that us as healthcare practitioners, we can draw some kind of lessons to how we deliver care, and that standard doesn't drop. What have you done? Yeah.
Well, it is indeed quite challenging, because you see, for our kind of restaurants, we pride ourselves for being creative and then providing an overall dining experience. So there's a lot of showmanship in some of our cuisine, you see. So we are talking about even like singing or presenting.
Which we can't do now, singing. Not too much.
Exactly. Yeah, and then some calligraphy presentation together with the food. So, it will not be the same if it become takeaway or delivery. We can't possibly, come up with such an experience. But we still try to make our delivery items as presentable as we could. Yeah.
Okay. How do you keep your food fresh and, kind of to the taste? You have to...
I think that is not much of an issue because the delivery is quite, and I would say most of the time
faster,
quite punctual. Most of the time.
You set KPIs for him.
Yeah. Most of the time they're quite punctual. I mean, because of the competition. So each delivery platform will have to perform, in order to attract their customers. Otherwise, they have to pay they have to compensate, if there is a problem. Yeah.
It's all challenges for us to kind of mull over. And then, Jason, I was thinking about travel, and I think we all do feel a lot for the industry, aviation. I think a lot of our friends who we know personally in the aviation or the airlines had to reinvent themselves, and the footfall, this is probably of all the industries, it's probably the hardest hit, the most contraction. So, how has the CAG kind of had to reinvent itself or innovate through the crisis, both maybe for the people who work in the group, and then the future traveler, for example. Yeah.
So, I know, spot on, right? I think we have 50,000 people working in the airport community. And Changi is what Changi is today because of the people, right? Because service is delivered in a very personal way. And many of them actually have worked in the airport. Easily you will find a large number of them for 20, 30 years. So during this period of time, together with the other 200 over companies that are all parts of the aviation community, we try to keep as many people in the core as we can, right? Naturally, some of the people who are not local, but during this circuit breaker period, they stayed at where they are, they didn't come back to Singapore. So here we kept as many of the Singaporean core as we could. And that actually is actually highly important because when travel recovers, we don't want to lose the kampung spirit or the community spirit that has been very deeply rooted in the entire service culture of Changi. So here, even during this period of time, some of the colleagues actually undergo new training. There's a large push for automation, as well as robotics and many of this innovation in this space. So actually, the staff actually go through those kind of training. Say for example, some of the ground handlers, together with them, we put some of the staff to go through airside driving, which is another requirement or skill of its own that they never had time to do so, because we always say if you have to do anything at the airport pre-COVID, it's called an open heart surgery. Where the whole system is running up to the neck with 200,000 passengers a day, it's almost impossible to take a break and do something. So you got to do it as you go. All of a sudden, this circuit breaker or this period where the traffic is so low, it gives you also an opportunity to reorganize, to rethink about how do you position yourself for the uptick when it comes. So that's a opportunity we're taking together with all our partners. But one thing very core to it is, as we're doing all those things, we have to keep the morale of the people high. Right? Changi, I would say that is quite iconic by itself, and therefore the people working there for many years, they take a lot of pride being part of the community. So here, actually, they have to believe that this COVID challenge is transitional, right? The whole demand for travel has not gone away, right? And Asia is definitely one of the growth region for travel. So once they keep that focus and know that we just have to work and come out of this thing stronger, that's the way we keep everyone together and still do what we can. The one of the things that's interesting is this: today, even if you got a low number of passengers, we serve every passenger coming to Changi like a first class. In fact, better than the first class in the past, because they got a lot of attention. We chaperone them and make sure that they feel really at ease, right? But the good thing that you hear from some of these passengers, like last month there was a couple who waited in Australia for a month until we opened our transit corridor. They could have flown through some Middle Eastern airport. They chose not to. They say we have done transit in Singapore back to Europe for the last 20 years. COVID is not going to change that. Well, so when you get the kind of feedback from the customer, you feel very encouraged. So those are the stories that, all the frontline staff, they're talking about it. So they know that we still exist for a purpose, which is to serve the customer going through Singapore, and that doesn't change. So this is something that I've been doing with them and taking this chance to deepen, in fact, the mission-driven way that we build the service culture. And that is actually important because inevitably, during this period of time, we lost some people. But when travel recovers, you have to bring back new people. So your core that upholds a very strong service or Changi DNA for service, you need to keep that intact so that they will train the new people coming on. If you lose this during this period of time, when travel comes back, you will get a totally different group of people. Then I think to really rebuild the service culture, it will be a challenge. So those are the things that we're also working hard during this period of time, to keep up. Yeah.
Okay. Now, I think this last segment, I'd like to look forward. So we have kind of looked back, and we have also looked in the present, what we are doing now. And I think some of the things that we would like to wonder about and kind of think about would be what, in each of your industries, what would it look like in the future? Do you think, we don't have a crystal ball, but if you had, do you think things will never be the same again? Would they go back to our good old days, in 2019 and before? Or what do you think the future challenges would lie in each of your businesses? Yeah.
Well, I think for F&B, we all know that it's not going to be the same. So we have to really accept the new norm, and we have to accept that COVID-19 will be with us for a long time, maybe years to come. So mask on, using a disinfectant, taking temperature, all this I believe will stay for a long time in the restaurants. At the moment, we actually use more alcohol disinfectant
than people drink it.
Than people drink it. So yeah, that is quite a challenge for business. But what we are doing right now is to expedite our this digital transformation, knowing that it is not going to be the same. So first of all, no physical menu. We encourage them, our customer, to use their own phone to scan and to access to our menu and do their ordering there. And then we are working on linking it to the CRM system, the customer relationship management system. So they can earn points, they can download, they can redeem points, so that encourage customer loyalty. So secondly, now that we know that manufacturing of heat and serve of frozen food is paying off. We're receiving very good feedback. So we'll step up, we'll increase our varieties of products, and also going into the halal side. So we have 2 central kitchen. So now another one of our central kitchen, which is halal, will produce the halal heat and serve products. And we know also that the number of physical outlets in Singapore will likely to reduce because it is highly impossible to operate in the malls which are still charging very high rent, and knowing business volume is not going to be very big. So already we are hearing more and more restaurant group introducing the so-called cloud kitchens. And cloud kitchens can be created quite easily if you have a central kitchen. And we are embarking on that too. So very soon, I think in perhaps next month, we will be launching our own cloud kitchen. So that is also a wake-up call to mall owners. You know, if you don't take care of your tenants, they are going to close down and then move the brand to the cloud kitchen. So landlords has to understand this, the symbiotic relationship between tenants and landlord. I think this is the reality. Yeah.
Oh, I don't know, Jason, anyone? Will we all now become by economy class, become first class passengers? Because actually, in the hospital, everyone, the bed, even I have to split apart. So I'm
It is quite
thinking
nice.
the future is first class for everyone.
Jeannie has seen it.
Yeah, it is
So,
nice.
no, I think travel will continue to be strong. I think human needs that physical connection. What will be different? In fact, if you think about it, we ourselves is testing with the idea. One of the biggest challenge for us in normal travel period is peakishness of traffic.
Peakishness.
Right. So it's every infrastructural business problem, right?
Yeah.
Your passengers never come evenly spread out. So there'll be peak hours. Let's say I got 10 flights departing.
That's right.
And the whole check-in hall will be filled with people, and people got to queue. When there's peak and trough, there will always be queue because you cannot size up to 100% of
Right.
the throughput. So during this period of time, we realized that what we used to allow people to go onto our iChangi app to book an attraction or to reserve a restaurant in Jewel, actually, why do we not allow people to book when they want to do the security screening before they board the aircraft? So we are trying to do in fact, these 2 weeks we are doing the ground trial with a small number of passengers that we have. And that may fundamentally change the way people travel through Changi. Means that regardless of what class you travel, first class, economy class, whatever, you can actually indicate once you buy your air ticket, you know the time, the day of travel, straight away the timing come up for you to book the slot that you want for the security screening pre-board. So that's one thing that you can assure the passenger of safe distancing, because you don't want people to queue and congregate as a large group, which is what we typically see at the glass door before you board the aircraft. So this may present an opportunity, because in a normal period pre-COVID, you tell the passenger you're going to book your boarding, people may not really care about it. But now you're doing it for their own safety, and in fact for their own convenience. But of course you need this one more step to do advanced booking. But if this can become a new norm, then in the long run, it actually helps you even out the resource, because now you allocate the timing 45 minutes before aircraft takes off. You can book the slot that you want, and you will have to go there at about that time, and you choose, right? Of course, the first come, first serve. But it evens out. So when you reach the security screening, it's actually just in time. We know that we're expecting you, and you can just then take it without the queue. So if we can kick up that habit of just booking, it's no difference from you go to Disneyland and you get the fast pass, right? You also indicate a time, and then you come back at the right time. So from resource management perspective, actually that will be a fundamental shift for large infrastructure type of business like ours. But that also need a corresponding change in the user behavior. So some people may like it because if you are a frequent traveler, you say, I always time myself to this point, and therefore I don't want any uncertain queue length or queue time. So that those people will be the first adopter, and the rest of the people may have to come along. But in the long run, I would say that if this can become a new norm for traveling to airports, then I think it is actually good for the airport as well as for the travelers. And I say, why am I confident that some of this innovation will happen? I think the travel industry, whether it's SARS, whether it's 911, the resilience in the industry is actually very strong. They came up with added security measures, and then over time they worked out the kinks so that the passenger experience is not compromised. So those are the things that we're looking at now. And this COVID gave us a good chance to relook at some of those things, and how do you use digital solution, for example? Because now everyone is connected. Those are some of the tools that we can use to enhance the experience of the passengers.
Yeah, sounds like we can learn a few things. If that works out, I want to figure out how to prevent all the patients coming after lunch and after dinner.
Actually, that's a good point, right?
Yeah.
We set up by the ministry's requirement a swabbing facility at Changi.
Yes.
So in very short time, right, unprecedented, within a few days that your fingers can count, we put up a swab facility at Changi in T3, adjacent to T3 coach stand, and it can take up to 10,000 passenger a day. Right, so that's probably the highest throughput facility you can find in Singapore. So initially
10,000 swabs?
Yes.
Oh, wow.
The question is...
That's more than NCID.
Yeah, right, but one thing is about you will be surprised as why 10,000, right? Because first you must understand that the people going through the swab is very different from the rest of the swab around. These people are going to come in plane loads, assuming if you open up the green lanes and people can start coming. And your passengers, you look at other countries, they go through, they sit there for 4 to 6 hours at the airport in the environment they're waiting. Okay, so we say, okay, this cannot be Changi standard. So you calculate and you try to manage the throughput such that you have a certain service level that the passengers will not have to be there stranded, because that's not the Singapore way of doing things. So that's why even during the COVID period, when you try to put up infrastructure, you calculate some of those things to make sure that we still upkeep the Singapore's branding and reputation of efficiency. So I'll say that that's just a good example where we learn a lot during this crisis, and we have to really put our heart and mind together, work with partners to learn and how to come up with new solutions.
So one of your KPIs will be from landing to the back on the belt time. Now
that's what people say. In Singapore, those people that stay at East Coast, right? They say from landing to home in bed is 30 minutes. Right? So that's always the thing, right? Including taking a cab, just right outside. So now with this added step of doing the swabbing, what will be the new norm? So these are things that are working in.
Okay. How about Jeannie? I mean, we will miss, we used to go for medical conference, and now with the retrospect of COVID, I wonder why did we gather 1,000 people in a hall just to listen to a few people speak? But I mean, it's the interaction, right? I hear you are doing some hybrid. Do you think there will be buy-in? Kind of
for sure. So I echo Jason's point in terms of then being a pent-up demand for travel once we allow. I think in the longer term, we feel that the fundamentals for Singapore's attractiveness as a destination remain very strong. We have done a lot of dipstick surveys in our key source markets. The perception of Singapore as a destination remains very, very high. I think people want to travel to Singapore as soon as they can. So I think we're all optimistic that the demand for travel, when it's ready, will still be there. And so in order to get there, it's then now what we're going through a process of then how do we have safe itineraries, how do we have safe business events and conferences that will give people the assurance of safety, of health, even if and when they need to travel. And we feel that that's quite important. So there are a few important pilot projects that we're working on right now that will then take us to the new normal. You're right, it's not going to be the same as what it used to be, but I don't think it's going to be completely different either. So a lot more will be hybrid. For conferences, I think there's pros and cons. Hybrid conferences have been around for quite a while now, and it hasn't detracted from people wanting that face-to-face interaction. A lot of business negotiations, a lot of intimate learnings are still done in a face-to-face format, which is why we have worked very hard to also bring the kids back to school, right? Because learning takes place. You can't quite replace face-to-face with online interaction, so to speak. But you can do a lot through mixed event formats. So that's something we're working on towards the longer term. Other things that we're working on now is really because at the end of the day, tourists go where locals want to go. So now is the perfect opportunity for us to come up and curate new experiences, new products and offerings, test it with the locals, and if there's good feedback and if the locals feel that, yes, that's something that they enables them to discover more about Singapore, to better learn about culture and heritage, then we're very confident that when the visitors come, they will want to go and experience some of these same offerings as well, because it's been endorsed by the locals. The locals will bring their friends and their families to these experiences as well. And so that's a big part of our work now in terms of also test bedding different experiences. But it's a journey. We know that it will not be an easy road ahead, but I think we are taking as many steps as we can in order to ensure that we can emerge stronger as a destination once travel picks up again.
All right, we have about 10-15 minutes left. I'm going to move to Q&A from our live audience, and I think we have people from 14 countries around the world joining us, besides the folks in Singapore. Maybe I'll ask Wee Tang. It says there's a question for a Grab-related question. It says, thank you for sharing your various interesting experiences. Can I ask how Grab and the other industries determine what your evolving needs of your customers are? Any specific platforms or process in which the company routinely includes in your operation strategy? So how do you know what we need? I mean, how do you know we need Grab delivery? Right? How do you evolve? Yeah.
So I think we look at, when we think about new features, products, look at a number of things. Obviously, number one is whether we are solving a real problem using technology. I think that's number one. If we can solve it using technology, there's definitely one service or product that we will look into. Whether there's market fit, whether there's enough people who would like to use it, buy it, or there's a supplier who's willing to do that. And then, of course, you do all your research, talking to customers to think about their needs, right? So, for example, going forward, one thing we saw is there's a big shift to digital economy. I think the Microsoft CEO said the best. He saw 2 years of digital transformation in 2 months, right? And similarly in Singapore, we see a big shift now. A lot of merchants, especially SMEs, are moving to digital world. And so seeing that, how can we then help them to do that, to make that shift, right? So 2 things we were doing, for example, would be we developed a GrabFood capability development pack, basically to help these SMEs who have never been online before, to tell them, teach them how do you sell online. People buy food not because of some words, but you look at pictures. Number one, pictures are very important. So how do you take good pictures? Number 2, how do you put attractive, cool sounding description to your food, right? If you call it a fish soup versus your grandma's fish soup, which one will you buy, right? You call it
grandma.
Yeah, exactly, right? So
well, it depends who's grandma. Yeah, true. Yeah.
But these are things that we want to teach our merchant, that to increase attractiveness to the merchant, to the shop, right? The other thing is we also develop what we call a Grab Merchant app or tool, portal, basically allow the merchant to understand a bit more. We provide them a bit of analysis. We tell them these are your highest selling SKUs. These are time of the day that you have your highest orders, so that they can plan their work around, whether it's workers or ingredients, to make sure that they can serve the demand, the increasing demand.
Okay. Yeah.
So these are things that these are the things that we do to understand what's the need and then try to execute as best as possible.
Okay. There's one question here. It says to the panelists, okay, this one can be anyone, government and private sector cooperation in a crisis like this. Do you think Singapore's setup of GLCs and private sector establishments has allowed us to react nimbly enough as compared to countries in the other parts of the world? How can we improve? What can we do better in terms of private-public cooperation? Yeah. It's open for all. Yeah.
Well, I guess it's not necessary just whether you are a private company or whether you are a government organization. I think the good thing in Singapore, taking from the day we started to respond to COVID in the earlier period, maybe February, March till now, I think one thing that is very clear or has shown is how the private and the public organization in Singapore were able to come very quickly together, look at the policy, and then respond to it. That, I think, if you compare around different parts of the world, where people are still running tussles between, even within the same government organization, that, I think, is one great feature for Singapore. Sharing the same mission and wanting to do well together as one group. So that, I think, is very clear. We know it for sure because Changi was at the forefront in the early days when, straight away you got to do temperature screening for flights coming in from, say, China, for example, in the early days, and then subsequently to many other countries. And these people not only have to do that, later on you do selective swabbing for people who may be symptomatic. So all this are done by private companies, whether it's ourselves or, in our partner from Raffles Medical Group. And you react very quickly to what the government agencies are looking at. And like the earlier example talked about putting up this swap facility, that's necessary if you want to open up a green lane, then within a few days, the facility is up. So I think those are very critical working together on the ground. And even now, thinking about recovery, I think even for CAG, we might be the airport business. But the thing is, we have been working very closely with STB. We've been working very closely with MOH. In some of this research work that they may be, or trials they're running for the new saliva test versus a PCR test, right? Working with STB, looking at new MICE event or new kind of clean bubble itinerary for travelers. Okay, so those are the things that I think, not just us together, STB, also together with many of the other tour agent and EOS event organizer on the ground. I think those are the things that I would say is very unique to the Singapore Inc. Concept that we have. And it's something that we hope that we don't take for granted, because in many other countries, I think for them to come together to get the act out in double quick time is not easy. And even if you look at the challenges that we have in a foreign workers dormitory, I think the coordination is not easy. I mean, we may take it for granted, watching it from the outside, but the amount of work going through to make sure that all the workers are safe, so that some of them can over batches come back to work, which is a very important part, to support the reopening of many of our businesses. Okay, that I think ain't easy, and I think within such a short period of time to do that for such a large population, I think those are the things that is really uniquely Singapore.
Okay, one question for you. 5 minutes left, so maybe 20-second answer, Jason. How do you maintain, because healthcare PDPA is very important, so when we scan iris and do all that, how are you going to manage privacy issues, for example?
Okay, so those scanning of biometric information, those are captured by the ICA. So they are a government agency, so they take care of that. For those that we do for other purposes, right, for the backdrop and the check-in, those we also manage them, as strongly and as safe as what the PDPA requires.
Okay. Now, one question is open for all. Working from home, sometimes your employee, are they like resting at home, RFH or WFH? How do you know that they are working? And as employers, as long as they deliver the report on time or they show up for meetings, or what do you do now? Is it the new norm? We are more the new age boss, or how do you manage that? Because for us, this is a foreign concept, right? I mean, it was pretty much, yeah.
Well, honestly, I think
you like it, don't like it?
No, I don't quite like it. So so I have to keep reminding our younger staff, okay, while you work at home, make sure that you deliver. You don't go all over the place, because we will have some spies checking on you.
Okay.
Yeah.
For me, it's very much, we've been so busy this whole past few months. In fact, I think I'll be very happy if my staff can rest from home, because we've just been inundated, and it's, every day we are working, 24/7. We have several ops that are running through the weekends as well. I think that's one thing that happens when you work from home. You kind of no differentiation between day and night, weekend, weekday. But we trust our staff. I think we have a good amount of trust in the organization. We all are working towards a common mission, common objectives. We all know that deadlines, milestones, that are urgent things that are there and need to be done. So in that sense, I only wish I could have more rest time for them.
Okay.
No, actually, echoing Jeannie's point, actually I'm more worried about my employees, my staff overwork rather than not working.
Okay.
Because when you work from home, there's really no demarcation between work hours and office hours. My calendar now starts as early as 8 a.m., ends late night, weekends, there's phone calls, Zoom calls and all, right? So, and the team is working really, really hard, a lot harder than going to work, to be honest. So actually we are more worried that they are working too much. And the second thing is, because of the shutdown in travel, most of them are still trying to save up their leave and hoping to travel maybe end of the year. So many of them have not been taking any rest for the last 6 months or 7 months, right? So we are also encouraging them, hey guys, you probably won't be able to travel so soon. Please take some leave and rest at home. So yeah, I think we are more worried about to go on staycation.
We have a different problem. Our people are asking to come back to work.
Oh.
So that is a totally different set, because because of the regulation, we have to keep people working from home. But you see, the nature of our work needs a lot of contact and people want to come back. So ours is that we know they're working from home because of all the Zoom calls and Teams calls. But our people have been asking, when can we actually come back to work? They miss their colleague. So when you have a culture that is people-oriented and they just want to come back. So we have a different, so we're not worried that people are resting at home. I mean, that's fine. I mean, but our challenge is more people want to come back to work.
Okay, so quite interesting. Kind of like there's a whole spectrum here. I think healthcare, it's a bit, there are people who would like working from home if you're not seeing patients. And some, we like to come because we still like to talk to our colleagues, and even if you're not seeing patients. So yeah, so pretty interesting. Now I think we are almost at the end of our time. About 5 more minutes. I just want to. We have how many minutes left? About 3. Okay, 5 minutes. Okay, so now change management is always hard. So the question here is, what challenges in change management have you seen, and how do you is it up on the screen? Change management. So how have you managed people to adapt into new roles? Because both in terms of your staff, your vendors, new ways of doing things. So I think what was maybe, because you had people in the hotelier industry doing totally like different clientele, different kind of job scope. What was it which clinched it? Like all of us
I think at the end of the day, people realize that it's a national effort, right? And I think everybody wants to contribute if they can, and then it's just equipping them with the necessary skills to keep them safe. So I think at the end of the day, if the staff know that you have their safety first and foremost at the top of your minds, then I think they are willing to run the mouth for you. You're right. So we've had hospitality staff that's very much at the front lines. Resorts World is managing Singapore Expo as a community care facilities, and we have quite a few other hospitality groups as well. All the hotels that are serving as quarantine or stay home notice facilities, as well as the cruise ships. So in terms of change management, the biggest barrier is that you may not be used to doing what you are doing, but then you actually realize that you do have the skills and capabilities to be put to good use and to serve a greater need and to kind of combat COVID as a national effort. So I think that in itself is the biggest motivator that enables people to make that change and know that they are doing it not just for themselves, but for the greater good. And then as a government agency, as employers, I think, and management, we had to work with them to ensure that top priority was always to keep everyone safe. And so the protocols have to be strictly adhered to, the safe management measures have to be strictly implemented and followed, and that's not something that is negotiable.
So a common mission and also making sure staff safety. I think quite similar with Grab, you had all these, the drivers and the people working for you knew that they were being cared for. I think that's a challenge. Now, I'm just going to end off the session by asking you if there was one word you think which brought you through the crisis thus far, and it's very important for the months, or hopefully it will be, I don't know how long this will last for, but what is the one thing, if you could crystallize it in a word, that it's important for you, your company, and the people that you care for and lead? Yeah, just anyone. Yeah. So.
Just one word.
Yeah.
One word. Only teamwork. Right?
Sorry.
Teamwork. Yeah. Get through this. It's not just one corporation or one person, individual. It has to. Everyone got to come together and solve it and help each other. Yeah.
Whereas I would just use it's just courage and resilience. Because it's such a big unknown, and if people are overwhelmed by fear, then I think everything will break down. So I think having the courage and the resilience to tide through this period will be what's most important for us.
Well, I have to. Oh, sorry. Go ahead.
Go ahead.
Well, I have to say passion, because passion made possible.
Okay. Oh, well, okay. Yeah.
Had to pull in the plug.
You had to. Okay. All right.
I would say understanding, because there are so many things that we do which is unusual. So we may not be able to make everyone understand why we have to do this, do that. So we need a lot of understanding from each other, especially from between the staff and the management, and trust that the management that we are eventually doing it for the majority.
Yes, I think for healthcare, I would say trust. Yeah, because patients entrust us with their lives. We trust that our colleagues will step up and have cover our backs when we need their help. So I think trust is important, and if we trust each other, we can get through a crisis together. I mean, we had a very fruitful afternoon, so it only leaves me to really thank our guests for spending their precious time. They are really busy people, but it was just so interesting just hearing across all our favorite sectors of the economy and some of the challenges they face and how they are innovating and how they will continue to innovate. And I think there are a lot of things for us to learn in the healthcare industry from our colleagues from all these different industries. Looks like our time is up. I'd like to thank the people who joined us on the webinar. Please don't go away. At 4:30 p.m. there will be a documentary featuring several homegrown innovations fitting our CHI Innovate webinar theme, breakouts and outbreaks, learning and innovating in a crisis. And we'll see you at 4:30 p.m. Thank you, everyone.